As drug prices continue to skyrocket, one particular area I continue to focus on is how we can stop big pharmaceutical companies from taking advantage of patients and our healthcare system. Big Pharma is endlessly creative when it comes to ways to game the system and pad its pockets. So let's take the Medicaid rebate program. Drug manufacturers have to provide rebates or discounts to states as a condition of having their drugs covered by Medicaid. States then share that discount with the federal government. Manufacturers are supposed to give larger discounts for brand drugs, which are typically more expensive than generic ones. But true to form, some drug makers may have misclassified their drugs in order to shirk their obligation to provide that larger discount, leading to more than $1.3 billion in lost discounts from drug manufacturers from 2012 to 2016. People might remember this issue from when Mylan, the maker of EpiPen, misclassified the EpiPen as a generic drug. So, Administrator Verma, how is CMS tracking the classification of drugs in the Medicaid rebate program to see if there are any misclassifications?
So first of all, in terms of the classifications, I will add in terms of the Medicaid rebates that the Affordable Care Act actually capped the amount of rebates that manufacturers had to give. So even as they've increased their prices, the Affordable Care Act actually capped the amount of rebates. But in terms of the misclassifications, I agree with you, this has been a significant issue. We know in the case of Mylan, that there was definitely an issue there. We worked around a settlement of that came to about $465 million that came back to taxpayers. What CMS has done is put out guidance to manufacturers to make it very clear to them what the requirements are regarding the classification. The problem that we have, however, is that we don't have any enforcement authority. So we can put out guidance, but if they are not classifying appropriately, then we're limited in the amount of action that we can take.
So that was going to be, and I realize I'm running out of time, but my last piece of this question was just going to ask you, would you support additional authority from Congress so that CMS can impose civil monetary penalties on drug makers who knowingly misclassify their drugs in the Medicaid rebate program?
Yes, we do. Yes, we would, and I think that our efforts around the Mylan settlement, shows the amount of dollars that taxpayers are losing, and so we'd be very supportive of that.
Thank you very much, and thank you, Mr. Chair.